Good afternoon, Mr. Ahern.
Hello.
My name's Sheila Hardesty. I'm Dr. Miller's clinical nurse today. And I'm going to do an examination of your head and neck and report my findings to him. Okay, first I'm just going to take a look. I'm looking for asymmetry. Tilt your head back a little and forward. Rotate to the right and to the left. Okay, when I check for asymmetry with the neck, I'm checking to make sure that your trachea is midline and not deviated, which it is perfectly normal. I'm also looking for any pigmentation or tics, and I don't see any. Have you had any problem with any like nervous tics on your face?
No.
No, good. Okay, when you move your head and neck, do you feel any cracking or have any pain or discomfort?
No.
No. All right. I wash my hands right before I come in, so I'm going to go ahead and check your head and scalp. That's all right. I'm checking for any lumps or lesions, tender areas. Do you have any that you've noticed?
No.
Dry, patchy areas?
No.
Okay. Then I'm going to check your lymph nodes. Lymph nodes are often swollen with infection or viruses, sometimes with cancer. I'm just going to palpate here at the base of your skull for the occipital. Check your postauricular, preauricular, submandibular, submental. And you have 3 strands of cervical nodes. Okay, if you could undo your top 2 buttons probably, then I can check your supraclavicular nodes. Put your hands on your hips, lean one arm in at a time, and whenever you palpate enlargement of these nodes, you need to get it checked because it could possibly be a sign of cancer. Okay, don't feel anything enlarged. Okay, now I'm going to take a listen to your carotid arteries. Can you please hold your breath? Okay. Now while I have the stethoscope, I'll go ahead and listen to your temporal arteries. You don't have to hold your breath for these. What I'm checking for is blood flow and that there's no bruiries. I don't hear any bruiries, and if I did, they could be a sign of an aneurysm, which could be legal, something you would need to get checked. I'll go ahead and take a listen to your sinuses, your frontal and maxillary. Very good. Now we want to check those. Any tenderness or swollen areas there?
No.
All right, now I'm going to check if you have any problems with your jaw locking or popping.
No.
Okay, this is checking for TMJ. Open and shut your mouth. Again. Very good. Next, let's see what else the doctor would like me to assess. Okay, cranial nerves. I'm sure you've heard of cranial nerves.
Yeah.
We're going to check a few of those today and make sure they're functioning properly. Number 1 is the olfactory nerve. And I want you to tell me when you can smell something.
No.
All right. Now I'm going to wash my hands. Just want to check your nerves with your pupils. Checking your pupils and your fields of vision actually tests about 4 different nerves. Okay, first I'm going to check that your pupils are equal, and they are. And if they react the same, then let's shine the light into them. And the one that I'm not shining the light into should also react, which it did. So we'll check the other side now. Okay. Now we're going to check your six fields of vision. This checks cranial nerve number 3, 4, and 6. If you could follow my finger. Very good. And checking your pupils checks the optic nerve and also your visual acuity, which you said you haven't had any problem with seeing.
No.
And you've never worn glasses in your life.
No.
Great. Okay, cranial nerve number 10. I'm going to look in your mouth. And when you say ah. Okay, good. Your uvula is pink. Looks normal. Your uvula is the thing that hangs down the back, and your tonsils set on each side of that. That checks cranial nerve number 10. Cranial nerve number 5, or the trigeminal nerve, is checked with the sensation on your face. So I want you to tell me if this feels even on both sides.
Yes.
There's 3 fields of that.
Yes.
And here.
Yes.
Okay. All right. Now, can you smile and puff your cheeks? Okay, I'm looking for asymmetry or drooping. Everything looks normal. Okay, now could you stick out your tongue and move it to the left and to the right? That checks cranial nerve number 9. Cranial nerve number 11 is your accessory nerve. And we check that with resistance. I'm going to put my hand here against your jaw, and I want you to turn your head. Good. Now I want you to turn your head the other way. Good. All right, now I'm going to put some resistance on your shoulders and ask you to shrug your shoulders. Good. Your strength feels even. Okay, we've got one last thing to assess, and that's your thyroid gland. I'm going to feel it for any tenderness, nodules, orders. We'll palpate the lobes. Your thyroid lobe should be about 4 cms or less, and the right should be just a little bit bigger than the left. Okay, if you could take a sip of water and hold it in your mouth until I tell you to swallow. And tilt your head back just a little as you swallow. Good. And one more time. I want you to do that while I have my fingers on your throat. Swallow. Good. Okay, Mr. Ahern, that completes my assessment today. And I will let the doctor know
Thank you.
my findings, and he'll be in shortly.
Thank you.